Alright, so we're going to do some exercises to restore the plantar flexion loss that kind of occurs after having plantar fasciitis or just kind of throughout. And so right now I have Nico, and we're going to do a 1-4 exercise on the matrix. And Nico, what I want you to do is you're going to use this red band as resistance and kind of pull back, keeping upright posture. I want you to press your foot kind of down like you're trying to press a gas pedal there, and I want you to do 10 reps for 3 sets of that. All right, so our next exercise is called an active calf. We're going to do it eccentrically. And so this is going to be a 2-2 on the matrix. And Nico, what I want you to do is we're going to be in this mountain climber position. And so we're going to go up with 2. We're going to try and raise our heels off of the mat, and then we're going to kind of let your body go down with 1. So if you need to bend kind of one knee or anything like that, yeah, and just kind of unweight one leg and go down with 1 there, just like that. So it's going to be an eccentric exercise trying to strengthen as well as elongate the plantar flexors. Welcome back to the closet. So our next exercise is going to be a 3-3 on the matrix. And so what we're going to do is have Nico sitting in the chair. And to provide feedback, if you have a ball at home or something like that, it would be great. But if not, we were thinking paper towel roll or something of that nature. We're going to place that between her legs. And so what I'm going to have her do is squeeze and contract her core to hold that there while she straightens her leg and then performs ankle pumps here, kind of pressing her toes down as she's pressing on the gas pedal. And so that's one exercise we can do for restoring that. So next kind of part of the matrix exercises, we're going to do a 4-1. So this is kind of called like a modified calf raise, and we're going to use a towel under their toes, especially their big toe, to kind of maintain that extension of the toes while we're performing our heel raises, kind of keep them in that WINDLASS mechanism as best we can. And so we're going to do our heel raises. Sorry. We're going to do them very well, as you can see. And so what we're going to do our heel raises, and we can kind of come up and then go slow down. We can also progress us to just eccentrics, going up with 2 and down with 1 as they gain more strength.
Yeah.
All right, so we're going to change it up. We're going to do some inversion techniques to try and strengthen that posterior tib, help with the medial longitudinal arch, kind of strengthen in that area. So what we're going to have Nico do is seated in a chair, trying to keep her knee kind of stable and straight. We're going to just invert her feet kind of there, yep, and making sure we're not rotating up here or anywhere in that nature, just trying to move just her foot. And so we can progress with adding weight or resistance band, but this is what we're going to work on right now.
Yeah.
All right, so we're going to progress with some kind of home exercise programs, exercises that we can give our patients when we're in the clinic. And so this next one is just kind of plantar fascia kind of specific stretch. And so we can kind of educate our patients on making sure maybe they do this before they get out of bed, since usually the first couple steps in the morning is when they're most painful. They've been sleeping in that plantar flex position, which kind of tightens that plantar fascia. So we're going to do this plantar fascia specific stretch. And so what we can have our patient do is just kind of bend your knee up on the other side. And with one hand, you're going to kind of dorsiflex your foot as much as you can and extend those toes, producing that WINDLASS mechanism there. And kind of stretching out. And you can feel, if you've gotten a good stretch, it should be tight on the plantar fascia. And so our next exercise for the home exercise program is going to be just kind of seated ankle pumps. We kind of saw this earlier, but we're going to have our patient sitting upright, band around her foot as she's pressing down, as if she's pressing the gas pedal. And so we can do that to strengthen her plantar flexors. She can also, come up fast, slow down, get some eccentrics, trying to elongate that kind of plantar flexion there.
Yeah.
All right, so here's some special tests that you can do in the clinic to rule out or rule in whether your patient has plantar fasciitis or plantar fasciosis. So we're going to have our patient weight bearing, full weight on her leg and foot. As we have her do this, we're going to extend her big toe, if I can pick it up. So we're going to extend there, trying to produce that WINDLASS mechanism and produce a stretch here on the plantar fascia. Positive would be pain with that, especially that medial kind of calcaneal tubercle, as we've talked about before.